who we are. Tucson Functional Medicine. And we are the only clinic that I know of anyway in Tucson that has specifically focused our entire clinic on functional medicine. There's one other certified person in Tucson that I know of that is doing functional medicine. There are a lot of people that will tell you they do functional medicine. But as we'll talk about as we go through this, they're actually not. So what is functional medicine? There's two schools. There's a lot of schools out there saying they teach functional medicine, but there's only two schools that actually can certify functional medicine practitioners. One is called the Institute of Functional Medicine. And if you've heard Dr. Hyman, he is the one heading up the functional medicine program at the Cleveland Clinic, and they have teamed up with the Institute of Functional Medicine. And the only other school that can actually certify is Functional Medicine University. Now, I went to Functional Medicine University, but they're both great schools. But what you want to make sure is that the person that you're being treated, that is telling you they treat functional medicine, is actually certified. Like I say, one of the doctorates I have is a naturopath, and I would have told you before I went to functional medicine, oh, functional medicine is just a philosophy change. And I can do that. That's no big deal. And once I took functional medicine at school, I was like, holy smokes, this is a whole nother way of looking at the human body. So this was done a few years ago, and it was done by the CDC. This is a graphic from the CDC. And so it may even be worse than this right now, but 60% of Americans have a chronic disease. 40% of Americans have 2 or more chronic diseases. So this is kind of our elevator speech on what we tell people when people ask us what we do. With 60% of Americans having a chronic disease, people are wasting more and more time in doctors' waiting rooms. Tucson Functional Medicine offers health programs to get to the cause of your health problem. And that's the big difference. And we'll go into it in more detail. So you can spend less time in waiting rooms and more time enjoying the quality of life that you deserve. So healthcare in America, unfortunately, has become about the dreaded waiting rooms. The statistics are now saying that from the time it takes you to actually get to see a doctor, we're pushing 2 hours now before you actually get in and see it. So we have a cute little movie here about the waiting room, so enjoy.
Waiting room. I hate when they make you wait in the room, because it says waiting room. There's no chance of not waiting. Because they call it the waiting room. They're going to use it. They've got it. It's all set up for you to wait. And you sit there, you know, and you got your little magazine. You pretend you're reading it, but you're really looking at the other people. You know, you're thinking about them, things like, I wonder what he's got. As soon as she goes, I'm getting her magazine. And then they finally call you, and it's a very exciting moment. They finally call you, and you stand up, and you kind of look around the other people in the room. Well, I guess I've been chosen. I'll see you all later. You know, so you think you're going to see the doctor, but you're not, are you? No, you're going into the next waiting room, the littler waiting room. But if they are, you know, doing some sort of medical thing to you, you want to be in the smallest room that they have, I think. You don't want to be in the largest room that they have. You know what I mean? You ever see these operating theaters that they have with like stadium seating? You don't want them doing anything to you that makes other doctors go, I have to see this. Are they going to really do that to them? Are there seats? Can we get in? Do they scalp tickets to these things? I got 2 for the Winslow tumor. I got 2.
I think the saddest part about where our medical system is today is Seinfeld can make a routine about it, and we can all relate. So the real question is the current healthcare model that we have working? Right? I mean, if it's working, there's no reason to have a different model or to have another option. There's no reason. So this comes out also from the CDC, and we have the links to actually go and read about this if you actually want to. But life expectancy over the last 20 years has been decreasing. So it was going up, going down, going up, and going down. But I saw, I think it was last year, 2019, I saw a Sanjay Gupta, Dr. Gupta. I don't remember what news service he's with, but he actually talked about that for the last 7 years, and I believe this was 2019, life expectancy had decreased every single year. So what I did was I took, this is the article, and at the bottom is the actual link if you want to go read it. And life expectancy in America has decreased for the first time since 1993. So, and it didn't decrease a whole lot, 78.9 to 78.8. But if you think about it, there's 340 million Americans, I think, 330 million, 340 million. So for it to go a down 1/10%, that's a pretty big number. And the biggest thing is of the top 10 causes of death, 8 of those top 10 saw statistically significant increases in the disease. One saw a decrease, cancer. They're actually having more luck or more results, I guess, not luck, but having more results treating cancer in America. Less people are dying. And one stayed the same, deaths from influenza and pneumonia. But the largest climbs in the deaths were from heart disease, had a 9% increase, unintentional injuries, 6.7, Alzheimer's disease, 15.7% increase. Other top killers such as strokes, diabetes, suicide also increased. So if you look at this, not all, but most of these are chronic diseases. And I just threw some numbers in here. And so this is from 1980. Right, let me get my little marker here. So from 1980 is when they took this up to 2013. Okay, so malignant neoplasms killed over 135,000 people. Well, now it's killing almost 160,000. Right, liver disease, 16,000, 20,000. So what we're seeing is we're seeing all of the causes of death for mostly chronic diseases are getting worse. Look at this. Diabetes, 25,000. Now it's 50, almost 54,000. So the name of the game is chronic disease is killing most Americans nowadays, okay? And the question is, how is our current medical system working with chronic disease? It's not doing very well if deaths are going up. So the quality of life and people's actual dealing with chronic diseases in life is getting worse. We're getting more and they're having more deaths, okay? So if we have the disease symptom model, which is what our system is, it's not a health model. We call it a healthcare system, but it actually isn't about health. It's about treating the symptoms of disease. That's what we're doing. So if this isn't working for chronic disease, we need a new model, right? We need to form a partnership between the patient and the doctor to actually get on top of chronic disease, okay? So functional medicine has become that bridge. Functional medicine is all about quality of life, chronic disease. It's about getting to the cause of the actual condition, whatever it may be. So the rest of this talk is about what is functional medicine? What makes it different? We're going to take a few conditions that are pretty common, diabetes and thyroid problems, and we're just going to show you the difference in the way the traditional doctors would deal with it and the way the functional medicine doctors will deal with it. To kind of get a little bit of an understanding of what is different. Why would I want to go to a functional medicine doctor? So the traditional model is all about these things, right? It's all about diabetes and cancer and arthritis and obesity. That's what we're focused on in our society. And the real problem is everything that's under the water. So most everybody knows that 90% of an iceberg is below the water. And that's what's actually causing everything above the water. So it's inflammation. In fact, in the, one of my patients actually gave me this, in the ARP bulletin in 2019, November of 2019, they talked about how the underlying cause of all health problems in America is inflammation. Inflammatory problems, hormonal, detoxification, structural imbalances, immune, mitochondria, little energy plants for your cells, the digestion. So this is all this stuff below the water is what is actually causing everything up here above the water. And so functional medicine is all about what's below the water here. Traditional medicine is all about what's above the water. And there's a time and a place for both. So who does Dr. Oz go to?
Today, I'm answering the number one question I get asked no matter where I go. Which doctors would I send my family to? I call them the disease detectives because they're using new clues to prevent and to cure disease. Doctors on the cutting edge of medicine with a radical new understanding of why you're tired, why you're gaining weight, hooked on medications, and struggling through menopause. Could their new approach to healing be the answer that you have been waiting for? A cutting-edge group of medical detectives who go beyond the symptoms to uncover the underlying causes of the illnesses you fear most. They are forerunners in a new field called functional medicine, which strives to reveal the root of your health issues by looking at your entire body and your environment.
So what makes functional medicine different? And we're going to find out here in a minute. Functional medicine is not new. We just didn't call it functional medicine. But what does functional medicine? It identifies what the factors are that are responsible for whatever is malfunctioning. It's not just looking at the malfunction and then giving you a pill to help you with the symptoms. It's asking the question, what is causing this malfunction in the first place? Then what we do is we deal with whatever is causing it in an appropriate way for the patient. Every patient is different. And we can't just start to put patients in a box. And that's really what we do in our traditional medical model. And it's because of time. I mean, I used to work in the traditional model, and it's not about the patient. It's about the disease. It's about, can I get through 35 to 40 patients today? That's what this is all about. So we use advanced laboratory testing to identify the root cause. So these are different tests. We're going to show them to you in a little bit, but these are different tests than what your medical doctor would use. Do we do blood tests? Well, we can, but the problem with a blood test is it's like a bunch of red check engine lights. If your blood sugar is high, fine, but it doesn't tell us why it's high. So we run tests that are looking at the systems behind what it reports on the blood work. Now we do some blood work, and some people really want to see their blood work from a functional medicine perspective, which is perfectly fine, and we do that. And we're going to go over the advanced testing, what kind of makes our testing different. Basically, this is like what we would today call old-fashioned diagnosis. Because what does it do? It listens carefully to the patient. Nobody knows the patient better than the patient. And we ask questions. But the average doctor visit in America is like 7 to 15 minutes. It's really short. And you can't get to the cause of any problem in 10 minutes. You just can't. But if you take the time to listen to the patient, and the father of modern medicine, this is actually what he said. So here he is. This functional medicine is not new. What functional medicine is a return to what medicine was before the late 1930s and the 1940s. So this is Dr. Osborne, I think is what his name is. But basically, he is considered the father of medicine is Hippocrates. We'll see what he said in a minute. But this is the guy that we now consider the father of modern medicine. He was involved in forming Johns Hopkins Medical School. He was also the first physician in chief of Johns Hopkins. And listen to what he says. A good doctor treats the disease. The great doctor treats the patient. This is something else he said. If you listen carefully to the patient, they will tell you the diagnosis. But the average doctor is spending 7 to 13 minutes with a patient. They don't have time to sit and listen to a patient tell you what the actual problem is. So this is the father of modern medicine, and he's talking about a system that is very different than the system that we have. Wrong way, sorry. So this is the father of medicine, Hippocrates. Listen to what he says. Let food should be our medicine, and our medicine should be our food. The average family that has children at home is seeing going to a fast food joint an average of 9 meals a week. So what kind of medicine is that? If Hippocrates said our food should be our medicine, what kind of medicine are we putting in our body if we're eating 9 meals a week at a fast food joint? So he was all focused on the digestive system. All disease begins in the gut, Hippocrates said. So look at this other statement by him. A wise man ought to realize that his health is the most valuable possession that he has. What we do is take our health for granted until it's gone. And we need to change our health philosophy in America. We need our health philosophy to actually be a philosophy about health, not about disease. Because if you get a system that is focused on health, guess what you will have less of? Disease. This isn't rocket surgery. Thomas Edison, the doctor of the future, will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Now, we are 180 degrees opposite of this. And these were people in the early 1900s. I mean, Hippocrates wasn't, but these are people in the early 1900s, and they were still looking at medicine as being from a preventative model. Now, what we've come up with in America, and I'm not against these, but we've come up with blood tests and urinalysis and x-rays and MRIs, and I'm not against any of these. But I think they've made doctors lazy because we're no longer treating the patient. We're treating whatever the results of the blood test or the urinalysis is or the x-ray or the MRI. That's what we're treating. The patient is irrelevant. If you gave me a blood test, I could build you a treatment plan. The patient doesn't even need to be involved in the equation. And I think it's really made doctors lazy. So when we're treating symptoms versus treating the person, medication is used to get rid of people's symptoms. I'm not against them. But if the patient stops taking the medication, what usually happens? The symptoms return. So I was teaching nutrition in Dallas one year, a few years ago, and this medical doctor comes up to me and she says to me, well, now that they've got my blood pressure pill under control, my blood pressure is under control. And what did I say? No, it's not. And she says, yeah, actually it is. And I said, no, actually it's not. And she said to me very condescendingly, if you don't think that my blood pressure is under control because of the medication, you don't understand the human body. And I said to her, stop taking your pill. Because there is something causing the blood pressure to go up. The blood pressure does not go up by itself. There's something causing it. And what we do is take a pill to artificially suppress the blood pressure, and I'm not against that. I don't want you dying of a heart attack or a stroke while we're figuring out what's causing it. But if you don't deal with what causes that high blood pressure, as soon as you take the pill away, since nothing was actually done about what causes it, the blood pressure goes right back up again. if you step back and you think about this system, it's unbelievably short-sighted. We're all about creating a solution for your symptoms and allowing the disease process that's causing the symptoms to continue to get worse. So this is an example of the thyroid. So there's many different causes of the thyroid. We have primary hypothyroidism. And what this actually is this is a thyroid, and we're going to show you the tests that we do about it, but it's a thyroid that doesn't actually kick out enough T4. So your brain is constantly monitoring T3. And so when it sees that there isn't enough T4, your brain tells the pituitary to tell the thyroid to kick out more T4. And it does that through TSH, thyroid stimulating hormone. And if you are in that 5% and your thyroid isn't actually kicking out enough T4, and you put somebody on Synthroid or levothyroxine, what's going to happen? Those drugs are T4. So if you give the body more T4, the body converts it into T3, and then everybody's happy. That's 5% of the cases. Then we have another one, is you can have a problem in the pituitary that keeps telling the thyroid more TSH, and it's not because there's an actual problem, but the problem is in the pituitary, and it keeps telling the thyroid, kick out more T4, kick out more T4. You can have a tertiary or a third option, a problem in the hypothalamus. Now that's your brain. That's the part of your brain that tells the pituitary what to tell the thyroid to do. And if you have a lot of stress in your life, and everybody does, almost every one of my patients says, well, I'm not stressed. I know I'm not stressed. And we take the stress test that we'll talk about here a little bit, and they're stressed out of their mind. But stress has become so normal that we don't even feel stressed anymore. So what we've done in America, when we everybody knows the saber-toothed tiger, right? And that creates stress, and I have to run away or fight the saber-toothed tiger. What we've done in America is repackage the saber-toothed tiger. We now call it husbands and wives and kids and parents and the coronavirus and politics and bills and the IRS, and go on and on and on. So what we've done is created all this stress level in America that we are stressed out most of the time. Well, when you're stressed out, your body goes into that fight or flight mechanism. Well, when you're in the fight or flight mechanism, your body must bypass certain systems so it can focus entirely on either fighting or running away from whatever the threat is. So what does it sacrifice? It sacrifices your brain chemicals. It sacrifices your sex hormones. It sacrifices your digestive system. It sacrifices your detoxification system. And it also sacrifices your thyroid. Because the conversion of T3 into T4, when I have a saber-toothed tiger in front of me, I don't care about the conversion. I got to get away from the stress, the saber-toothed tiger. That's the third option. The fourth option can be we're creating enough T4 in our from our thyroid, but we're not converting it into T3. So on the traditional medical model, we look at TSH. I'm not against that. We look at that one also, and we'll show you the other ones that we look at. And if you are in that 5% of the cases that your thyroid actually is not kicking out enough T4, that they'll put you on levothyroxine or Synthroid, and that'll solve the problem. The problem will solve. That's fine. I'm not against that if you actually have that. But what if you have the secondary or the third option or the fourth option? How are we going to find that? So the traditional model takes TSH, thyroid stimulating hormone, on a blood test. What do we look at? Well, we look at TSH, we do the same one, but we also look at free T3, free T4, total T3, total T4. And we look at what's called reverse T3. Because when you are stressed, your body still converts T4, but it doesn't convert it into T3, it converts it into what we call reverse T3. and your body can't use that. So we look at it because from those markers that we do from a functional medicine perspective, if you have a bunch of T4 and you have no T3 or very little T3, what that could be telling us is you're making the T4, there's no problem with that, but you're not converting it into T3. Or if you see a lot of reverse T3, what this probably means is that you're stressed and you're not converting T4 into T3, you're converting T4 into reverse T3. And this is what is involved in getting to the underlying cause of a thyroid problem. So let's take another one. Fasting blood sugar. Now you'll see little blood drop guy here. This is the traditional doctor. And on the next one, that will say functional medicine doctor. But a traditional medical doctor, they consider your blood sugar to be normal until it gets above 100. Why? Because insurance doesn't start paying for the treatment of elevated blood sugar until it gets over 100. Because once it gets over 100, we can diagnose you with a term called diabetes, and the insurance kicks in and starts paying for your treatment, glucophage, metformin, whatever it is. Functional medicine doctor. Research shows that actual damage is happening to the human body once your blood sugar is above 86. So we set 86 as our top end model. Why would we wait until it gets to be 100? If you're doing damage from 86 to 100, why wouldn't we get it at 90 and start working on it to push it back down below the 86 so it stops doing damage? This is the difference in the models. The traditional model only treats you once the insurance kicks in. So what we have is a compensatory driven model. We won't, if your blood sugar, if you go to a traditional doctor and your blood sugar is 99, that doctor is going to tell you there's no problem in your blood sugar, because there is no problem until you have the disease, what's above the water, not below the water. But the research is very clear. From 86 above, you're doing damage. So what we want to do is prevent the damage from happening so you never get diabetes. This is going to scare some people. Medicare guideline 2251.3 says, a treatment plan that seeks to prevent disease, promote health, prolong or enhance the quality of life, or a therapy that is performed to maintain or prevent the deterioration of a chronic condition is deemed medically not necessary. So what is this telling us? Our healthcare system is not going to help you prevent getting diseases. It's not going to promote your health. It's not going to enhance your quality of life. It's not going to prevent the deterioration of a chronic condition. It's going to treat the symptoms. So insurance is actually saying, if this is going to help you, we're not going to pay for it. I mean, that's how crazy our system has become. And it's getting crazier every year. I mean, Medicare is stopping covering new things, and a lot of existing things, they keep reducing. So we have a system that is not focused on health. We have a system that is focused on disease. So instead of making you fit into the protocols, which is how our traditional model works, what we do is ask the body to tell us what the issues are, and then we work on the issues. So we just need different tools. We got to look at the body in a new way. Functional med, at least in our office, I can't say for every functional medicine doctor, but we never spend less than a half an hour with a patient. You also never wait in my waiting room. Your time is just as important as mine. So if you make an appointment with me and you're in the office at your appointment time, you will be seen at your appointment time. We do not make people wait. I am not more important than you. And we will spend enough time with you so that we can actually listen to you and figure out what the actual cause is. Let's talk about what some of the different tools are that we use. So we use different testing as a functional medicine doctor. So we look at the body based in 3 big body systems. Now, do I still believe that all disease begins in the digestive tract, in the GI system? I do. But remember what we talked about earlier. If you're stressed, your body completely shuts down your digestive tract. So if we don't deal with the brain and the stress levels and things like that first, we can treat the GI system and the detoxification system till the cows come home, and it's not going to work. Now, I have a doctorate in naturopathic medicine, and we were taught in naturopathic medicine, start with the GI, start with the digestive system. And so when I first became a functional medicine doctor, I started with the GI system. And I put people on a whole bunch of pills, and they felt better, and they thought I was the greatest doctor in the world. Well, one of the tenets of functional medicine is you shouldn't be on pills for the rest of your life, even if they're natural pills. That's one of the differences of a naturopath and a functional medicine doctor. The functional medicine doctor's desire is to work him or herself out of a job. You shouldn't need me to be healthy. I can't make you healthy anyway. I can help you, but I cannot make you healthy. So what are we talking about? In the neuroendocrine system, neurobrain, endocrine is things like your pituitary. So back when we were talking about the thyroid, the hypothalamus, the brain, was telling the pituitary, the endocrine system, what to tell the thyroid to do. So if we don't start with the neuroendocrine system, and we don't start working on stress and all these kind of things, everything downstream from that is going to fail. So what are we talking about? We're talking about adrenals, right? We're talking about brain chemicals, neurotransmitters. We're talking about energy levels. That is a huge problem in America. Huge problem in America. We're talking about female hormones, because what don't we care about when we're stressed? Sex, the whole hormones, estrogen, testosterone, we don't care about those things. Then once we are moving, it doesn't have to be fixed before we move to the next system, but we need to be addressing the stress so that the work we do on the GI system actually will have effect. So what are we talking in the GI? We're talking small intestines, large intestines, right? We're talking about bugs that are there that shouldn't be there. We're talking about what kind of food are you putting into the system? We're talking about leaky gut. Talking about the microbiome. I guess they're calling it the holobiome now, not the microbiome. And everybody knows about that one, you know, eat yogurt and take probiotics and prebiotics. But let me tell you something. If you don't fix the holes in your gut, leaky gut, and you don't get the bugs out of the gut that should not be there, fixing the microbiome is worthless. And everybody's working on their microbiome, but nobody has plugged the holes and nobody has killed the bugs. Then we go over to the detoxification system. What are we talking about? The liver, getting rid of stuff, right? You have phase 1, phase 2 of the liver. Inflammation, huge problem. We talked earlier about the AARP journal, AARP bulletin, I guess they call it. And in November of 2019, they've now said inflammation is undermining all of our health and all of our disease. Oxidation, that's why we actually die. Oxidation is the body breaking down. So the real fountain of youth in the world is to figure out how to eliminate all of the oxidation. And if we eliminate all the oxidation, there is no reason that we should ever die. And nutrient replacement, right? What nutrients are you deficient in that we need to replace temporarily until your lifestyle gets on track? So in the first one, the adrenal cortisol, the test we run is called the adrenal cortisol test. And what it's looking at is cortisol and DHEA. So it's what I said earlier, but if you're under stress, you suppress the function of your brain, sex hormones, thyroid, digestive system, and detoxification. Because when I'm stressed, I have a saber-toothed tiger in front of me. I do not care about digesting food. I don't care about having sex. I don't care about purging toxins in my body. What I care about is getting rid of the saber-toothed tiger, or running away, more likely, right? And so what we've done, as we said earlier, we've just repackaged the saber-toothed tiger. We have a whole webinar that we did just on stress. So stress has become so common that most people don't even think that they are stressed. And you ask somebody and they'll say, no, I'm not stressed. And then we do the test and we go over it. People are always like, man, how can I be stressed if I don't feel stressed? Because stress has become normal. And since stress has become normal, we have learned to deal with it. It doesn't mean it is normal. It means that we no longer feel stressed, even though we are. I've never done, I guess I did one, no, I don't think I've ever done a person's adrenal cortisol test, and it was normal to start with. Because everybody's stressed. I don't care who you are. So then we look at the digestive system. Well, the two tests we use, one is called the SIBO test, the small intestinal bacterial overgrowth, because you can have bugs growing in the small intestines. And if you do, we got to get rid of those, because what do we do predominantly in the small intestines? We absorb food through the intestinal lining to put it into the bloodstream to take it to the cells, and the cells use the food to run the mitochondria, the little energy plant. Every cell in your body has a little energy plant. So I live in Tucson, and here we have TEP, Tucson Electric and Power. That's who provides our energy in Tucson. In the cells, it's just called the mitochondria. It's just a little energy plant that provides the energy so the cell can do its job. And then we run a test on the large intestines called the GI map. Now, this is a relatively new test. It's only been out, I think, about 5 years. I could be wrong on that, but I think it's about 5 years. And it's now looking at DNA markers of what's going on in your large intestine. So what are we looking at? How about the microbiome, right? This is bugs that should be there. So what this test looks at is it looks at the microbiome. We don't want an overgrowth or an undergrowth. We want a balance in our microbiome. And that's what this test looks at. That. The first part looks at the microbiome. Is some things high, some things low, or is everything in balance? Then it looks at the body systems that are involved in digestion. The gallbladder, the pancreas, all of these type of things. The second part of the test tells us about how these things are interacting. Is the gallbladder working? Is the pancreas working? Then the third part, and this is half the test, this is the majority of it, but these are the bugs that should not be there. Okay? So we want to balance in our microbiome. We want to make sure that everything is supposed to be working is working. And then we need to get rid of all the bugs that shouldn't be there. That's what the small SIBO test is looking for too. It's looking for the bugs that are living in the small intestines. This one is going to show you the bugs living in the large intestines. The detoxification, we run what is called the organic acids test. This is probably, I can't say for everybody because it's a very complicated test and a lot of people don't really understand the test. And I don't know if a lot of functional medicine doctors use this test. This is our go-to test. This gives us the broadest understanding of the human body. So it tells us how are we bringing fat, what we eat, into the citric acid cycle, which is the system that makes energy inside the mitochondria. So we should be bringing fat into the mitochondria and using it to make energy. How are we using sugar? Are we bringing sugar in and using it to make energy? Then it looks at the actual citric acid cycle itself. Each part of the citric acid cycle, is it doing what it's supposed to be doing? So that it can take the fat, the sugar, the protein, and make energy out of it. And then B complex. Well, one of the big things that runs our citric acid cycle is B vitamins, and the second thing is amino acids. So this looks at B vitamins. Do you have enough B vitamins to run the citric acid cycle to be able to use the sugar and the fat to make energy? Well, methylation, methylcobalamin. So anytime you can buy a B vitamin and the bottle says methyl, you always want to buy that one. because it's better absorbed into the human body, better utilized. So we look at the methylated markers because if these are working better or good, we're going to be able to use our B vitamins to run our citric acid cycle, to utilize our sugar and fat to make energy. And what do we call energy? I'm not very good at drawing this stuff. TP. That's energy. And that's what your body uses. Each cell uses ATP to do whatever the cell is. So you got brain cells. If you're making enough ATP, your brain cells are going to work good. You got muscle cells, all these things. Okay? So all of this in this test, and it's the first 21 markers on a 46 marker test, tells us about how your cells are actually producing energy. Then we have a part of the test looking at your brain chemicals. Now you have many chemical pathways in your brain, but the two biggies are the dopamine and the serotonin pathways. This test tells us about this. Oxidation, we talked about that a little bit ago, but oxidation, what kind of oxidative damage is actually going on inside your body? This test tells us that. And how's antioxidants working? Detoxification indicators. This is phase 1 and phase 2 of your liver. How are those working? Are we able to get stuff out of the body? And then it has this information right here is about the digestive system. So the organic acids test is the test that we use once a year. Once a person is doing well, we use this test once a year, and we really pay attention to these. Now, if we've run your SIBO and your organic acids test from back here, we don't pay as much attention to those because the other ones are direct markers. But if we're only running this one, it does tell us about bacteria in your digestive system, stuff like that. Then it gives us a yeast marker. This is where we usually will pick up yeast infections. Unfortunately, the system that we use for the stool tests, the chemicals that they use to preserve the bacteria and the growth of the bad bacteria kills yeast. So yeast almost never comes up on a stool test, but this one tests it. It's actually a pretty good test. We do catch it, not all the time, but we do catch it. And so what about blood work? We do run blood work. And what we do is we have a deal with LabCorp. You go get LabCorp, you get a bunch of blood run, and then that blood gets spun down, frozen, whatever needs to happen to it. And then LabCorp overnights it to a lab in Southern California called Avixia, which is more of a functional medicine lab. And they go through and they do all the tests. And we run way more tests. We showed you with the thyroid, right? The traditional medical model runs TSH. We run TSH, free T4, free T3, total T4, total T3, reverse T3. So a lot of times what people will do is they'll have us run their blood work once a year because they usually get blood work done by their medical doctor anyway. And we run way more than they do. So when it comes time for their blood work, they just take a copy of their blood work and they give it to the doctor. And then usually if it's been done within a year, the doctor will accept it. And most of it's the same as what they do. We do have more stuff. But what we do is we take your blood work and then we put it into a computer program that looks at it from a functional medicine perspective. So we take a 3 or 4 page blood work report and we turn it into a 40 to 60 page report that tells you what's going on. Like right here, this was the test taken June 14th. This was the test taken January 27th. And did it get better? Thumbs up. Did the markers get worse? We also can look up to 7 blood works. So what we can start to see is the trend over time. Is what we're doing working over, most people only get blood work done once a year, so we can be looking up to 7 years. The other thing is, if you're very conscientious, you get your blood work, you go home, and you sit down with everything that has an H or an L on it, and you get on the internet, and you start looking up, what does that mean? Well, we've done all that for you. In the report, we have each marker that's high or low, and we tell you, what does that actually mean? The doctor should be doing this work so that you don't have to. You should have to focus on nothing more than getting healthy. So this is the major difference. The medical world assumes that 95% of people are normal 2.5% are high and 2.5% are low. Because why? They only kick into gear when disease happens. So the blood sugar, we talked about that one earlier, they set the top end marker at 100. Because once you're at 100, I can say you have diabetes, and then we can get paid by the insurance company. What we do is we assume 60% of people are normal, 17.5 are above optimal, 17.5 are below optimal, and that's when we want to work on stuff. We want to work on it when it's above or below optimal before it gets to the 2.5, which is where the diseases start. So we're looking at it from a health perspective, trying to prevent disease, instead of looking at it from a disease perspective. Now we'll kick into gear. We don't want to throw out our current model. Our current model works very, very well. Emergency rooms, surgery, things like that. So I always tell people, if I get run over by a truck, do not take me to a functional medicine doctor. I want to go to the emergency room. I want the medical doctors to put my bones back together, and I want them to give me some pain pills. But I don't want to be on the pain pills a year from now. So what we need is we need to keep our medical model for what it does such a great job at. But by their own admission, they're losing the battle with chronic disease. So what we need is a new model for chronic disease. Functional medicine is not here to replace any doctor. What it is here to do is look at your health from a different perspective and help you need the medical doctor less. I mean, isn't that really what everybody wants? Everybody wants to be healthy. And yet you're spending 2 hours in doctors' waiting rooms, and then you're getting pills to treat the symptoms, which allows the disease process or the damage or whatever's happening to get worse. That doesn't make any sense to me. So functional medicine is the update. So I call it healthcare 2.0, right? Or Dr. Oz called it healthcare for the 21st century is what he called it. So it's being offered in Cleveland Clinic, Johns Hopkins, Harvard Medical School. We talked about that earlier. So in our office, we treat anything, but these are the things that we really kind of focus on. Osteoporosis. I do a fair amount of osteoporosis work, and almost everything that we've ever been told about osteoporosis is just not true. Drink your milk so you grow up and have big, strong bones, and exercise so you get stressed to the bones so they build up stronger. I hate to, well, you do need calcium to build bones, but you need a lot of other things too. And unfortunately, it's now, what is it? It's 50% of the people over the age of 60 in America have osteopenia or osteoporosis. So we focus a lot on that. We treat restless leg, neuropathy, fibromyalgia, digestive problems, all of them, right? We treat all of them. Almost everybody has digestive problems. Thyroid, hypo, adrenal problems, Cushing syndrome, Addison's, things like that. How to detox, weight loss, healthy eating. So these are the things. People come in with a myriad of problems. Some people come in specifically because they have osteoporosis or neuropathy or something like that. But most people come in and they say, you know, I'm just fatigued. I'm just tired all the time. And I got this allergies and these rashes. Well, almost always that comes from the digestive system. Almost always. So hopefully this has helped you understand a little bit about what is different and why functional medicine might be a good option for you. So let me reshare my, actually, let me go here first. So if you're curious about functional medicine, you shouldn't have to spend money to find out if it's a good option for you. So what we have created is what I call our discovery appointment. It's free, doesn't cost you a penny. You can do it in the office here, or we can do a Zoom. We do a lot of work on Zoom. I have patients all over the US. I have patients in other countries. Oh, look at that 0 on screw that up, huh? So we don't need to have a patient actually in the office anymore, but you can come into the office, meet me, right? And to do this discovery appointment, 30 minutes, costs you nothing, because a lot of people, when they get in and they actually find out what is required, they might not be that interested, right? But you shouldn't have to pay to find out functional medicine isn't a good option for you, or you don't like me. right? I'm not perfect for everybody. And you may say, oh man, functional medicine makes sense, but Dr. T isn't going to work very well with me. Fine. You shouldn't have to pay money to find that out. Or you shouldn't have to pay money to find out that functional medicine isn't a good option for you. So we have it free. You can do it online through Zoom, or you can do it in the office, either way. So how do you do this? There will be in our PDF handouts, there will be a handout on this, but you can go right now, TucsonFunctionalMedicine.com, and under Contact Us, menu at the top of the page, there is one that says book an appointment, and you can go right in there, and we have options to book a free discovery appointment, either in the office or Zoom. And you can do it online. We get the message, we put you into our schedule, and then we'll see you either on the computer or we'll see you in person. But if you would like to find out if functional medicine is an option, something that you want to pursue, I'm tired of taking pills. I'm tired of not having a good quality of life. How much of life are you missing out on because we're not actually dealing with what the cause of your problem is? Would you like to change that? Are you just frustrated? Is your health just getting worse and worse every year? And the medical doctor tells you, well, you just got to learn to live with this. I will never tell you that. I don't believe that in any way, shape, or form. I believe that you can have the health that you're willing to go after and to earn. I truly believe that. So, is there any questions about functional medicine? There is. You have a Q&A box, don't you? Yeah, right here, Q&A box at the bottom of your screen, and you can just type in any question that you have, and I will do my best to try to answer it. We have about 6 or 7 minutes. Until a question comes in, I'm going to talk. As you'll see, I have no problem talking. So 2 weeks, we're going to run one, we're going to do a webinar on osteoporosis. Now what we do, and I always tell people, even if you can't come to the webinar, register. I'll send you a link for the replay, okay? We also will send you a link for all the PDFs that go with the webinar. I subscribe or register, I guess, to a lot of webinars that I have no chance of going to because I'm working in the middle of the day. I don't have the time to go to these, but they always send me the replay link. And then I can watch it on the weekend when I'm not with patients and stuff like that. So always register for these. We also have a YouTube channel. If you go into YouTube and you just type in Tucson Functional Medicine, you go to our page and we have, I don't know, I'm getting better at this. I'm not a big social media person, so I'm trying to get better at this. But we have, I don't know, 30, 40 videos on there right now, and we keep adding more and more and more. Our Facebook page is Tucson Functional Medicine Clinic. You should go subscribe to the page. All of the information on these webinars, and we have a lot of programs that we make available to people if you want to do them. Almost all of that either comes in an email to you or it comes on Facebook. On our website, TucsonFunctionalMedicine.com, under About Us, an option at the top of the screen, one of the options is Dr. T's teaching schedule. We've got the whole year planned, all the year planned, and you can go in there and right below each one of the topics is a little link, and you can go in and register for that seminar. You can register for the seminar right now in December. Now we upload them about a month prior to Facebook, but they're already on our website, okay? So, any luck treating a patient just diagnosed with Parkinson's has a slight tremor in the right arm? Parkinson's is a brain disorder. Now, do we have success? We do temporarily, okay? What we have discovered with functional medicine, if we actually improve a patient's quality of life, their diet, their stress, their things like this, most of the time, the actual disease process, it may not go away completely, but it slows down to such a point that sometimes people actually have, it takes 10 years for it to degrade or something like this, right? So we can't say we can cure it, but what we can say is a lot of times we can slow it down, really, really slow it down. And so I tell people with neuropathy, right, or MS, these are all demyelinating diseases. Well, we've now learned how we can actually rebuild the myelin sheath. Parkinson's is different. It's not about the myelin sheath, it's about the brain connection with the nerves. But if we can improve the brain function, they are having some great results with any brain disease with the ketogenic diet. Now, I wouldn't recommend, Gordon, you going on that, but what I would recommend is if you're interested in that, schedule a discovery appointment, come in and talk to me. And let's figure out if that's a good option for you. The high-fat diet, which we now call the ketogenic diet, was actually created in the 1930s. And it was actually created for people with epilepsy to help seizures. So we have learned that a lot of brain diseases, Parkinson's is, can be greatly helped through diet high in fat because your brain is mostly made out of fat. Okay, so I'd recommend, Gordon, either book your discovery appointment either online or in here, and we could sit down and talk about your particulars, because we spend half an hour, 45 minutes together, and you do most of the talking because you're the one who knows you, not me. Due to cost, is there a priority way to do the test? I'm not sure what priority way means, or best to do all the tests at once. About what is the cost of testing? Okay, great question. And we have more and more people that are actually starting their treatment with a functional medicine doctor by running the tests first. So what we have done is we used to try to use the insurance for testing. And what we found was the patient was just getting stuck with these huge fees after the insurance paid a little bit, and then they stuck you with the rest of the test. So what we did was we went back and we worked deals with the laboratories. Now, I'm sure there's a little bit of profit built into the test, but we don't mark up the test at all. We charge you exactly what the lab charges us. All 4 tests cost $1,005. So more and more people now are getting all the tests run, and then what they're doing is they're seeing where they are to start with, and then they're picking a program based upon what the test results are. So a lot of people are beginning to do it that way, where they want to see the test first. I'll break it down for you if you got a piece of paper and a pencil. The adrenal test is $125. The SIBO test is $200. In fact, here's what I'll do. I will put a handout with the cost of each one of the tests, and I'll put it in with the PDF handouts that we're doing, that we'll give you because of this. But we do the tests all the time. I have all the testing kits right in here. You come get them. The test kits are all, they include labels and bags to give it to UPS or FedEx or whatever, and they tell you how to do the whole thing. Everything you need to do the test is right in the box. You do it, you send it off to the lab, we get the results, we review it, and then what we do is we sit down with you and we go over the results with you so you can have an understanding of what that is. Hopefully that answers your question. If not, type one in real quick. We got to go in about a minute, but I do appreciate you guys being here. Oh, thank you. We're not here to nickel and dime you. Lucy said, grateful for no markup on the test. So we're not here to nickel and dime you. We're not here to make money off of all kinds of stuff. We do not carry supplements in the office. Why? I'm going to make profit on it. I just don't want to get involved in that. I'm not here to make money off of supplements or testing or stuff like this. I'm here to help you get well. I'm here to help you understand what is going to help you get better. That's what we're here to do, right? We make money on our programs, and I got a roof over my head and food on the table. I don't need a nickel and dime you, and we don't. So our goal is to try, because insurance isn't covering this, sadly, we've got to try to cut costs at any point that we can, okay? And that's just one of the ways we've done it. We had a patient up in Sierra Vista, and she got stuck with just the GI map test. She got stuck after Medicare paid their part. They told her that she had to pay $800 for that test. Well, if you do all 4 of the tests, it's $1,000, because we've got the labs to work deals with us to basically give it to us basically at their cost. I'm sure there's a little bit of markup in that, but they've taken out most of the things. So I do encourage you, if you haven't explored functional medicine before, make a discovery appointment. It costs you nothing, a little bit of time to find out, is this an option for me? If it is, wonderful. If it isn't, you'll learn about that, but it didn't cost you any money in the process. So, sure, you can forward this to anybody you know. Those discovery appointments are always free. They're always on my website. I would be very grateful for you to send it to friends. That would help me enormously. When the way that we're going to make America healthy is by helping the individual become healthy, and then that individual has friends. And if the individual understands health, they can help other people make better life choices, and that'll help them be healthy. And then those people have a realm of it, and it just keeps going. That's how we make America healthy. It's not who we elect. It's about you making the right decisions for you. And once you truly understand why you need to do this stuff, and that's what our programs are all about, teaching you to need me less. You shouldn't have to come see me to be healthy. Not at all. Okay, guys, I got to run. Thank you. 2 weeks, osteoporosis. Sign up, come. Thank you.